So if you don't own a machine, and obviously you're a practitioner, you think this, you've got the ideal candidate. Where could you find out if there are other places where you can refer to in your area? Is it kind of...
So I believe on the IDD therapy website, so iddtherapy.co.uk, there's a tab on there, I think it's called Clinic Finder, or Find the Clinic or something, and you can just literally type in a postcode and you'll come up with all the clinics in the UK.
Okay, that makes sense, because obviously it's a huge outlay initially, isn't it? But if you did think that was going to be good for your patient, then actually trying to find kind of like local practices. Okay, that's...
And that is a really important factor, because for most clinics, spending 50 grand up front is going to be quite scary. And you've got to have some confidence that you're going to fill the books with the machine to make sure you're actually going to make back that money. And I don't know how you run yours, but I've been to the clinic in Brighton, and the way we run ours is that the osteopaths don't run the machine. Rachel, in fact, runs our machine most of the time. We've got a couple of other people. She's a sports therapist, which means that, she has to be paid to run that machine, so we don't get all of the fees for that. We are covering the annual maintenance and so on. And we are also paying quite a lot of money for Google ads to try and get patients in to fill the books. We're not getting any referrals from spinal consultants or anybody like that. Now, I know you've got some very, very nice tame spinal consultants in London who I've spoken to myself. Do you get a lot of referrals from them?
We get some. We don't get a lot, perhaps in the volume you might think, despite my close relationship with them. But we do get some. Yeah, but those that has taken several years of getting to know them and developing those relationships. So I think the expectation should be, don't expect to get that many from the surgeons, is